Are you confused about the difference between MDs, DOs, and NDs? What do those letters even stand for? Well, I'm about to break it all down for you so you know the difference between each one of those and what it means for your healthcare. Welcome to my channel. My name is Lily and this is Lily's Natural Life, where I talk all about naturopathic medicine, naturopathic medical school, veganism, and sustainability. To start off, you probably get the idea of what an MD is. They're a doctor, obviously. Most doctors have the MD abbreviation after their name. MD stands for medical doctor, so they go to regular conventional medical school and they learn allopathic medicine. Allopathic medicine is medicine that focuses on the use of prescription medications and surgery to treat illnesses. MDs learn a very disease-centered approach in medical school, so this means that they focus on the symptoms and signs that their patient has in order to diagnose and treat their condition. Because they have a more disease-centered approach, they see the different parts of the body as separate instead of working together as a whole. Now, of course, everything is connected and everything does interact. They must take that into account, but they don't always look at a disease and think that, oh, this could actually be connected to another part of the body. Because they have a more disease-centered approach, they don't look at their patient in a holistic manner, in a way that evaluates their whole lifestyle, environment, well-being, all of that when they're looking at a certain set of issues. So they will focus mostly on the symptoms and signs at hand. So if someone is having heart condition issues or fatigue, they're probably not going to be looking at the mouth and wondering if maybe something in the mouth is contributing to the heart or fatigue or another condition. That's just an example. They see the different systems of the body as separate from each other instead of working together as a whole. Of course, medical doctors do address diet and lifestyle or exercise patterns as well, but that is not their main focus and that is not really their form of treatment in most cases. It's not a primary tool in their toolbox. Their toolbox consists of, as I said, prescription medication and surgery. MDs had to have gotten an undergraduate degree and then gone to medical school and completed a residency in order to be board certified and practice as a physician. Okay, now let's move on to DOs. I'm getting a little bit more out there. DO stands for osteopathic doctor. These doctors are trained in allopathic medicine just like MDs, so they focus more on prescription medication and surgery, but they also learn what's known as osteopathic manipulative treatment. Osteopathic manipulative treatment is the alignment of bones and muscles to promote optimal health. This is very similar to what chiropractors do. The difference comes to when this OMT and manipulations are going to actually be applied to heal the patients. Chiropractors will primarily use osteopathic manipulative treatment or manipulations to heal their patients, whereas osteopathic doctors, they may use it at times, but their primary focus will still be on prescription medications and surgery. Now, DOs are a bit different than MDs because they use OMT and they have a more holistic approach. They do focus more on diet, lifestyle, exercise, the other contributing factors to health than a typical MD would. They also have more focus on disease prevention. So their toolbox consists of prescription medication, surgery, and OMT. DOs also have to have an undergraduate degree, go to an osteopathic medical school, and then do a residency afterwards. Lastly, the ND or NMD. Naturopathic doctors will use either abbreviation. It is personal preference, and either one refers to a licensed naturopathic medical doctor. It's either ND for naturopathic doctor or NMD for naturopathic medical doctor. Either one. NDs are trained in naturopathic medicine as opposed to allopathic medicine. Naturopathic medicine uses the wisdom of nature to support the body's own healing processes. This means that naturopathic doctors, because they're medical doctors, they will also be trained in pharmacology or drugs, and the naturopathic medicine includes physical manipulation, which is what DOs and chiropractors use to adjust the body. NDs strongly believe in the healing power of nature and the body's ability to heal itself. So naturopathic doctors have a very holistic approach when they see patients. They look at their diet, their lifestyle, their environmental factors, all of that, and they look at the body as a whole and how it functions all together, and how one aspect or one system of the body may affect another system of the body. They highly focus on disease prevention. They focus on maintaining the body's health before any illness or disease can occur. Many MDs and DOs, they will say that you are fine if you're just below the cutoff for a disease, or what would be labeled as the criteria for a disease. They may just send you home. And then when you come back shortly after and you've reached past that milestone to call yourself diseased or with a condition, then they're able to start treating you, which is kind of a little bit of a backwards approach, because they treat you once you are sick instead of trying to be more preventative, instead of trying to heal you before a disease can progress. Now, this is just typical. I'm not saying that all MDs or DOs are like this, but this is more of how they're trained compared to a naturopathic approach. Like MDs and DOs, naturopathic doctors must have an undergraduate degree and then go to naturopathic medical school, which is 4 years long, just like MD and DO school. Then they can do a residency, but this right now is optional. Since MDs, DOs, and NDs are all going to medical school, they need to learn the foundational biomedical knowledge in order to treat patients and in order to practice with humans. So the first 2 years are going to be the same for all 3 degrees. They will learn anatomy, physiology, biochemistry, all of that stuff in the first 2 years. It is after the first 2 years, when clinicals begin, that things begin to diverge, because there are different forms of treatment. For DOs, they have to learn osteopathic manipulative treatment. For NDs, they have to start practicing acupuncture, homeopathy. They have to learn the physical manipulations, and so on. Now, I'm not trying to nag on MDs or DOs. They have provided a lot of knowledge to the medical community regarding acute conditions, and it's really helpful and valuable to us in the healthcare profession. And many people would die in those acute situations if we didn't have the knowledge that MDs and DOs have. But they lack focus on prevention and keeping people healthy. Some of the reasoning for this could very well be due to insurance companies and insurance coverage. What insurance companies will cover if they're only borderline a disease instead of actually diagnosed a disease. That's when they'll actually pay for treatment. Since most patients use insurance to pay for their medical care, they're not going to be able to get the financial help and the financial treatment through insurance companies if the insurance isn't going to cover them. That can definitely be a contributing factor to why MDs and DOs won't necessarily treat a patient until they've reached that threshold. So I hope this video helped to clear things up for you about the differences between MDs, DOs, and NDs. The ideal healthcare system would definitely be a collaboration between MDs, DOs, NDs, and other healthcare providers so that we can provide the most individualized care for patients. Thank you guys again for watching. Please remember to like, subscribe, and hit that notification bell so you get notified every time I post a new video. And follow me on Instagram at liliesnatural.life. If you want to see some more videos on what naturopathic medicine is and what naturopathic medical school is like, definitely check out some of my other videos on this channel. Thanks for watching, and I'll see you next time.